You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Ann Campbell. She is the founder of Laser and Integrative Dental Medicine of Northern Nevada. We've invited her on the program today to discuss advances in cosmetic dentistry. Dr. Campbell, welcome to the program.
Thank you for having me.
Now, before we get into today's topic, tell us a little bit about your practice. What kind of patients do you see?
Well, in my practice, we do provide all aspects of general dentistry, not exclusively cosmetic dentistry. We promote health for patients. That's very important. Health is really the foundation that you can build from in order to create a good cosmetic case. We always start with the basics. When patients come in, they'll have their complete examination, their complete set of radiographs. We check to see the condition, the health of the gum tissue, because healthy gums are very important. A lot of people are reading now and things other than Reader's Digest that, gum disease can be predictors of, heart problems and things like that. So we want to make sure that the patient is healthy. Once we are past that point, we always talk a little bit about what it may be that people are dissatisfied with their teeth. Everyone perceives themselves a little differently. So it's very important for us to hear from the patient what it is that bothers them. And then we go from there.
Now you feel, obviously you're a dentist, but you feel the smile's pretty important.
Absolutely.
How so?
Well,
as you see it.
The smile is in the middle of your face. No matter how we try to hide that, first impressions are very important. When somebody comes up and meets you for the first time, what are they going to notice? Your smile.
Smile. You have a great smile.
Well, thank you.
Anything, do you have veneers?
No, I do not. I was very lucky. I had a very good orthodontist who helped me to set up the type of smile that I was looking for. This was very specific. I went in with specific things that I wanted changed in my smile, and what they did is they did a computer scan, which is new in orthodontics. They did a scan for me, and that way they could move the teeth into position, and that way I could see exactly what it was going to look like before it was completed.
All right, now let's talk about your background and education before, and we're going to get to these before and after photos because they're pretty dramatic. How did you become a dentist, by the way? You don't look like a dentist to me.
Well, I actually started as a dental assistant, and the doctor that I worked for saw how I worked with patients and the types of things that I could do for him, and I picked up on procedures very easily. And he's the one that encouraged me to go to dental school.
Now, what's changed, by the way, in the last 10 years when it comes to cosmetic dentistry?
There's all different types of things. One of the main things in cosmetic dentistry is a lot of times we might do a little bit of recontouring of the gum tissue in order to give the illusion that maybe teeth are longer, teeth are wider. In the past, that involved scalpels, stitches. Not that way anymore. We use lasers for that.
Yeah, tell me about the lasers. What do you use them for?
Lasers are fantastic because oftentimes we can do procedures with only topical anesthetic, meaning I take a cotton swab, I put a little bit of liquid on it, paint it across the gum line, and that's all you need. We've had a lot of advances also in laboratory techniques and materials. The kind of materials that we have now are stronger, last longer. Also in that there's the strength that we have now, we can make these restorations, whether it be veneer or crowns, a lot thinner. A lot of times in the past you had those bulky looking, chalky white teeth.
Well, in fact, anticipating this interview, I was thinking about veneers, and I feel like I could spot them 10 yards away. They're big and bulky. Are you saying that, I mean, is that in the hands of the dentist? Is that the materials, as you put it?
In my personal opinion, I think it is in the hands of the dentist, because you have to know how to design a case in order to provide the laboratory enough space to work to make the teeth look authentic.
Okay.
If you don't, that's when you end up with those thick, bulky veneers.
What are the frequently asked questions about veneers? What do they want to know?
People want to know, are they going to look real? What color are they going to be? And of course, the most important thing, how much they cost.
Right. Now, what about pain in the process?
What I tell patients is when they come in for cosmetic procedures, their downtime would be the same as if they came in and had a filling done. If we need to use a local anesthetic, which we do in some cases, then their downtime is the length that the anesthesia lasts, which is usually 3 to 4 hours.
How much is art and how much is science when making a great smile?
I would say 50-50. The science part, that's mostly learned in dental school. I think that the art is something, it's like style. You either have it or you don't.
Okay.
And you can have a great lab, but if you don't know how to design a case for each individual person, you're not going to get good outcome. When I design my cases, it's done on an individual basis. When you look at my before and after photographs, all of the teeth look different. because they are designed for that person. The color is chosen for that person.
You say that you'll get a patient, change their smile, and they become a different person, or you change their lives.
Absolutely.
How so?
Well, for example, this patient here came to me, and
All right.
he has been in pain for years. Besides not liking how his teeth look, obviously pain is a major component that drives people to come to the dental office.
How so in this guy's case? What do you mean pain?
In this particular person's case, he had some very bad gum disease.
Okay.
That needed to be addressed before we could do the cosmetic aspect. Address the gum disease, got that taken care of, got everything healed up. Then we went through the process of designing his smile. I had him bring in some old photographs of how he looked when he was younger. That also helps to give me an idea of the direction that I'm going. Your tooth form, length, color, that's all hereditary. And I need to know where we started in order to begin that process. So what I did for him is I took some photographs, I took some molds of his teeth, and then I designed on paper how I want it to look, and I sent it off to the lab, and I asked them to do a mock-up for me in wax so I can see what it looks like. That way when the patient comes back, I can say, this is how you look now, this is the direction that we're headed.
Okay.
And then once they approve that setup that I have, then we move forward. The thing that I like about that is that is the setup we start with. That doesn't mean that that is the end all and that's where we're going to be. It gives me a base to start. Once I go in and prepare the teeth, the temporaries match my mock-up. Once those temporaries are in, the patient can say, well, this tooth looks a little too wide.
So they get to try them in first.
Absolutely. And I make any adjustments that they need. I make them right there in the chair. Then I take an impression of those temporaries and I tell the lab this is what we're going to follow. And it comes back looking exactly like that.
On a guy like this, I mean, huge difference. What'd you do for him? How many veneers?
This is a full mouth rehabilitation, meaning that every single tooth is either a crown or a veneer.
You say you see changes in people's personalities after you take care of their teeth.
Absolutely.
Is that right?
Most of the time what it is especially for women. The women that I see are very self-conscious about how they look. They don't want to smile.
Is that right? Is that what they tell you?
Exactly. A lot of times what I have to do is coerce them into smiling in order to get a photograph to start with. Because if you ask them to smile, they'll give you, show just a tiny little bit of teeth. I need to know what the overall smile line looks like so I know where I can go to design a good case for them. And I have a perfect example
let's take a
of
look.
that. This particular patient works in the beauty industry. People come to her for hair, for makeup,
It's
for
a pretty good
facial.
smile, though.
You're right, it is a pretty good smile. Where she started out was, if you notice, in between her teeth looks a little bit yellow in the front.
Yeah.
That's some old bonding. She used to have some spaces in between her teeth. There's also some crowns in the front. I don't know if you could tell which ones are crowns and which ones are her. Can't tell there. Also, if you look, her smile it's a little dark towards the back. You don't really get to see a full, broad smile. That is because in her particular case, she still has some baby teeth that have been retained. So what we did for her is we did our mock-up in wax. I took some measurements of her teeth and from looking from old photographs, and we created this new smile for her.
It's great.
Now, the thing that I thought was most dramatic about her is I saw her about 6 months later. She came in for her follow-up visit, and I didn't recognize her. She had lost about 35 pounds. Changed her hair, changed her makeup. She looked like a completely different person.
Is that what happens? Take care of their teeth, then they start taking care of themselves?
Absolutely. The confidence level goes up significantly, especially my patients that deal with the public, work with the public, whether it's in this patient's case, in the area of, beauty and cosmetics, or a lot of the businessmen that I see. They go to meetings, they travel around the country, they do international travel. They see themselves in before and after pictures. This particular patient, I actually just saw her a few weeks back again for another follow-up, and she was doing a 50th wedding anniversary for her parents. And she said she couldn't believe, in looking at all old family photos, the transformation of her teeth over time. When she was younger, she had a lot of gaps between her teeth. Then she goes through the phases where she has bonding. Now the bonding is discolored. Now she goes through the phases where she has her veneers, and she said, these are the best my teeth have ever looked.
Now when they see their teeth in a mirror, the new teeth, the veneers, for the first time, you get some tears?
It's always a shock.
Is that right?
Because they don't perceive themselves that way. It takes time for them to get used to, this is really how I look. I see a lot of tears. Tears of joy.
Tears of joy.
Tears of
okay,
joy.
we're going to take a quick break. We come back. I want you to take me through the process, what somebody can expect on day one. You're watching the Wellness Hour, leader in medical news and information. We are here with cosmetic dentist Dr. Campbell, and we're discussing what you can do to change your smile. We'll be right back.